GPs in England will vote at a conference next month on whether to cut the hours they are open to just 9 to 5.
With the system under more strain, is it time to close family surgeries altogether in favour of walk-in centres or even pay for appointments?
Currently in England, there are 6,514 GP practices, with an average of 9,400 patients between them. But those patients are waiting up to 10 days for a face-to-face appointment, 8 days for one held remotely. And you've been telling us today how hard many of you have been finding it to actually get those appointments online or in person.
Yeah, Purple Dahlia on Twitter. My GP turned off the e-consult 3 weeks ago. Nobody answers the phone. I really need to see or at least speak to a doctor. Sheila says, I'm a terminal patient. My GP made an appointment for me to discuss medications. 3 hours after the appointment time, she still hadn't called. I called the surgery. They hung up on me and they want to work less. Wendy, reduction in opening hours is completely unacceptable. It's more or less impossible to get through to my GP surgery now, let alone with less hours to do so. Well, joining us now to discuss this, Christopher Snowdon, who's head of lifestyle economics at the Institute of Economic Affairs, who thinks we should consider scrapping GP surgeries altogether. Anita Raja is a GP who says it's the government, not doctors, that are failing us. Very good morning to you both. Well, Dr. Raja, it may well be that the government isn't putting enough money into GP surgeries, but we understand that GPs are now going to vote on whether they should reduce their hours, which would mean you don't see as many patients, and patients are going to be pretty upset about that.
No, I totally agree with you. I mean, of course, it's upsetting not just for the patients, but for the general practitioners as well. I mean, unfortunately, it seems like the public feels that GPs are refusing to see them, whereas it's not the case. Yes, we say that it is funding, but the vital question here is, you do require funding for a service. Now, if we look at NHS England and we compare the amount of patients that NHS England sees versus the amount of patients that general practitioners see, general practices see twice as many patients, 1 million patients per day. Yes, these could be video consults, these could be face-to-face, these could be telephone consultations, but there's only so much general practice can sustain. I think we're exceeding our tensile strength now. Over the years, the funding has shrunk. Now, from 11% back in 2005, it's gone down to 8%, with 6% of the NHS budget, the healthcare budget, to source for staff, doctors, premises, all sorts of things. I mean, we've got to understand that there's only so much that GP practices can do. And at the moment, I think it's vital that we look at different aspects of sustaining this service. Yes, you've raised the question of scraping general practice. I certainly disagree with this because people who suffer from chronic diseases, people who are vulnerable children will lose out. There's going to be no continuity of care. I understand that you may not be able to see the same patient, but we've got a robust system in place where we look at clinical notes. And of course, there's continuity of care in terms of another GP picking up the work from a previous GP. So I think it's time for us to work together as a team and find a solution rather than considering scraping the system altogether, because that's not going to be workable at all.
Christopher Snowdon, if we scrap GPs, doesn't that shift all of the pressure onto A&E departments? And more than that, don't we need our GPs to be doing more to catch problems early and prevent diseases coming out of control or people getting into difficulties which then end up costing our healthcare system more?
Yeah, well, that's how it's supposed to work. And if it was working like that, nobody would be talking about any kind of alternatives to the GP system. But it's not working like that. People are not being seen. They're being triaged by receptionists. They're being forced to call up at 8 o'clock in the morning, because if you call the day before, the receptionist effectively lies to you and tells you there aren't any appointments for the next month, and you have to ring at 8 o'clock in the morning and
Why is
hope
that
they
a lie?
answer the phone. Because it's not true. They've got appointments. You ring them at 8 o'clock in the morning. They'll usually see you the same day. It's largely to make it look like they've got same day appointments for the records, but they're also trying to get rid of time wasters, as they would see in them, or malingerers. These are things that actually could be dealt with by charging for GP appointments. I certainly think that GPs should be paid for appointments rather than the number of patients they have on their books. There's lots of economic incentives we could be using here, but the system's not working. So we're not talking about sending everybody to A&E, although that's largely what's happening at the moment. We're talking about walk-in centres, not for every ailment necessarily, but for minor injuries and various other ailments. They work quite well. We've got one in Brighton. It's very successful. It's open from 8 o'clock in the morning till 8 p.m., including at bank holidays and weekends. So I think that if the GPs are just unable to meet demand, and it's not just about, it's certainly not about funding. I mean, we have a shortage of doctors, but we have a shortage of full-time doctors. Most doctors are working part-time.
You're talking about that Brighton Centre, is that an NHS walk-in centre?
Yeah.
OK. Dr. Raja, I mean, is that the alternative that, yes, you may not get a consistent, regular, familiar GP face, but for ailments that, somebody could see on the day and fix immediately, you just have a walk-in centre that is still free and just takes the pressure off GP surgeries?
I think there's a bit of a confusion here. I mean, primary care was never designed to deal with urgent problems at all. We do have urgent appointments, but there is only a limited, rationed amount of appointments that we've got for urgent problems. And, GP services were never going to deal with minor injuries or anything like that. So we were always going to expect these patients to go to urgent treatment centres. We were always going to expect these patients, if there is a major injury, to go to A&E. So I'm not sure what is being suggested here. And yes, when it comes to the distribution of problems, distribution of different patient cohorts, then we've got to triage this. Now, there's one point that I certainly wanted to discuss today, and this is why I agreed to come on the show. Patient education is key. If a patient calls up first thing in the morning and thinks that their question, their query is very urgent, they've got to think again. I mean, when I was invited to come onto the show yesterday, I made it a point to look at my list. I saw 30 patients yesterday. 25 is the maximum safe amount of patients you should see. I saw 30. And in these 30 patients, 6 patients had called in because they wanted paracetamol, thrush treatment. They wanted cold remedies, some airdrops, olive oil airdrops. And these are things you can actually purchase over the counter. So it's very important that we sort of understand that, when we're taking up these appointments, to call the GP.
Yeah, but sorry, Dr. Roger, I appreciate that. But the thing is, if you're ill, you're not supposed to be diagnosing yourself. If somebody's got a cough, for instance, that's been going on a long time, that person doesn't know whether they've just got a cough or whether, for instance, they've developed lung cancer and actually this is something that needs to be seen and intervened straight away. That's your job to diagnose it, isn't it? To put that burden back on the patient and say they're wasting my time with, sort of minor things that could be dealt with paracetamol or cold remedies. That's a little bit tough because people are going to feel like, oh my goodness, maybe this pain in my chest is just something that I should be dealing with, but with a bit of extra rest.
Isn't it also worse than that, actually, Dr. Raja? Isn't it also worse than that the patients who you want to come in are often the ones who are often most reluctant? And if you make it hard to come in or you have a charge, the people who go, the people who do the diagnosis Susanna's talking about, are probably not the ones who need the care. And the ones who need the care are often the most reluctant to go in and actually need that kind of support and information. And the danger is we actually just mean that they get sick and it becomes more expensive.
No, that's fine. And I'm going to answer your question. So there is no healthcare system that is going to provide you unlimited amounts of GP contact healthcare referral system for £140 per year per patient. £80 per contact is given to A&E and urgent treatment centres to see a patient, whereas it's £145 per year per patient for unlimited amounts of appointments. These should be 2 to 3 per year, but at the moment we're seeing it's gone up to 6 to 7 per year. And let me rephrase what I said before. These 6 patients were patients who knew that they wanted a free prescription on the NHS and wanted to not buy over-the-counter medications. So there was a lady who had thrush, which was positive on a swab. We messaged her that she can go to the pharmacy and purchase the pessary that's required, but she would rather speak to a GP to get it on a prescription. And there was a patient that wanted some paracetamol on the NHS, a patient who wanted Calpol for their child on NHS, and they did not have a fever. So it was just in case. So let me rephrase, these are not patients where we are actually looking for a diagnosis. These are patients who actually are calling in because they would rather have the doctor prescribe it. I know this is something we don't want to touch upon because it's a very sensitive issue, but we all need to contribute and act more responsible if we want the system to work. Scraping general practice is not going to work. The general practitioner...
Thank you, Dr. Raja. We're going to have to stop you there. We really appreciate the points you're making. We've actually been asking in a Twitter poll if you'd pay for a GP appointment. So far, 84.8% say they wouldn't want to pay to see their GP. So it sounds like our viewers have got a pretty clear view on this.
Yeah, Christopher Snowdon, I wonder if we can just quickly go back to you. Are we expecting, listening to Dr. Raja, are we expecting too much from our GPs?
Yeah, and I'm very sympathetic to what she says, actually, about people being basically time wasters. But this is what you get. If you allow everybody in the country access to highly trained professionals for free, that system is going to be abused and you're going to have people going in when they don't need to. That's why I think we should have a fairly nominal fee, but a fee to pay when you go to the doctors. And if you don't turn up, you lose that money, 10, 20 pounds, for example. That would be totally normal in any other country. It's not normal to be ringing up at 9 o'clock in the morning to try and get an appointment. Anywhere else, you ring up any time of the day, your doctor can nearly always see you that day. You pay them a few dollars or a few quid or whatever it may be, and that's it. We have a dysfunctional system, and it's largely because it is totally free at the point of use. It does get abused. I'm actually very sympathetic to GPs on this one.
OK, Christopher Snowdon, thank you very much indeed. Dr. Raja, good luck with your patient list today. Thank you very much.